should support free needle exchange programs, especially here in Wolfe County. How many of you have seen disgusting, dangerous, used syringes and needles lying on sidewalks and beside roads, or even around the school building? How many of you know of a struggling addict who uses needles to inject dangerous drugs into their system? How many of you want this problem to be stopped in order to care for our relatives, citizens, innocent children, and brave police officers? As a student here at Wolfe County High School and a citizen of Powell County, I would like to round up support for the free needle exchange program, which the Free Medical Dictionary defines as any program intended to slow the spread of AIDS and hepatitis C among IV drug users, in which a governmental or charitable agency exchanges sterile needles for dirty, potentially contaminated needles. When hearing such a proposal, the common man automatically assumes that this program will only be successful in providing drug users with the means necessary, needles, to further provoke their addiction. However, the common man is usually not educated concerning the severity of addiction, which is a debilitating disease. The common man also lacks empathy and usually believes that drug users only have one goal in mind, which is to use drugs as often as they possibly can. However, this program is an excellent life-saving program which aids addicts in recovering from life-threatening drug addictions. First, I will describe to you some problems within our community concerning drugs. Then I will tell you how your support of free needle exchange programs can improve our community. As most of you know, Wolfe County is a county sometimes known for drug overdoses and drug arrests. Free needle exchange programs reduce the amount of this danger happening around us. Several addicts actually lack the funding to be tested for HIV and or hepatitis C, thus leading to further infections via the use of soiled needles. The cost to treat an actual HIV or AIDS patient is extremely costly, and most of the money that funds the treatment is from our government, which aids to the $1 trillion of debt the United States already owes, whereas free needle exchange programs are actually cost effective. Police officers and innocent civilians are often in danger from addicts' risky behaviors, such as improperly disposing of needles, and police officers becoming infected from trying to stop addicts while on the job. Implementing free needle exchange programs has proven to be cost-effective and safer for innocent civilians and police officers, while providing free mental health and rehabilitation service referrals, as well as free HIV testing to addicts in need. Free needle exchange programs are surprisingly cost-efficient. Those against free needle exchange programs may claim that purchasing and providing needles to drug users is an extremely costly way to diminish the spread of HIV and hepatitis C, but this is actually not the case. According to a study published in the United States National Library of Medicine National Institutes of Health, a cost-effectiveness ratio of $20,947 per HIV infection averted was calculated based on an estimated 87 HIV infections averted across the 7 programs and total program costs of $1.82 million. Sensitivity analysis were also performed. Using imputed costs for donated services and estimates of lifetime costs to treat an HIV infection, syringe exchange was demonstrated to be a cost-saving strategy from a societal perspective. Also, according to the American Civil Liberties Union, it costs an average city about $160,000 to run a needle exchange program, which is about $20 per user per year, whereas one syringe-infected AIDS patient will require upwards of $120,000 per year in public health expenditures. In order to receive new clean needles from a needle exchange program, one must first provide used dirty needles. One should obviously conclude that this system will help to eliminate the amount of dirty needles improperly disposed of. This system also protects drug users from sharing soiled needles, which in turn prevents the spread of HIV and hepatitis C. In fact, according to the Foundation for AIDS Research, a Baltimore study demonstrated that syringe exchange programs help to reduce the number of improperly discarded syringes by almost 50%. Most free needle exchange programs offer free HIV testing and mental health evaluation services. In fact, according to the American Civil Liberties Union, a national survey of needle exchange programs found that in addition to exchanging sterile syringes for contaminated ones, 97% of programs provide a range of public services, including referral to a substance abuse treatment, prevention education for sexually transmitted diseases, HIV counseling and testing, tuberculosis screening, and primary health care. Not only do free needle exchange programs prevent the spread of HIV and hepatitis C, the programs also effectively treat the mental disease of addiction. HIV counseling and testing should be especially important to those living in Kentucky. According to a study conducted by the Center for Disease Control and Prevention, after nearly 200 HIV cases were diagnosed in one southern Indiana community, the CDC conducted a vulnerability assessment of counties most at risk of a rapid HIV spread through people who inject drugs. Of the 220 counties listed in the report, 54 of them were in Kentucky, and more than half are located in the Appalachian regions of Kentucky, West Virginia, and Tennessee. Wolfe County ranked number 1. Breathitt, Perry, and Clay counties were also in the top 5. So according to this report, Wolfe County, Kentucky is the county that is most at risk of a rapid HIV spread through people who inject drugs. This should terrify all of us in the room. This study shows that something must be done. Even if you don't support free needle exchange programs, you can't just sit back and say that nothing should be done. We should at least implement these programs to see what effects, the good effects that will come from them. Think of what a great reputation Wolfe County would have after implementing free needle exchange programs. What would it be like to have a cost-effective program that aids in preventing the spread of HIV and hepatitis C? Will you simply sit back and continue to live in a county known for drug addiction, or step up and support a program that offers aid for this community and its people? Support free needle exchange programs everywhere, especially in Wolfe County, Kentucky. Your support will continue to shape struggling addicts' lives in this community. We would not refuse a self-inflicted diabetic's right to obtain free needles, so why should we judge a struggling addict for obtaining needles to steer clear from HIV or hepatitis C? Put yourself in an addict's shoes and support free needle exchange programs.